Today, I want to tell you about one type of patient that I see nearly every day in my clinic. If you're in healthcare, you've almost certainly seen a patient like this. Even if you're not in healthcare, you probably know somebody like this. And if you're watching this video, this person may be you. This is the type of person that has significant amounts of fatigue, pain, brain fog, and symptoms that they just can't seem to get an answer to. These are the type of symptoms that frustrate physicians, they frustrate family members, and most importantly, they leave the patient feeling very frustrated. Now, before we get into that today, I want to introduce myself. I'm Dr. Nolan Fisher. This show is called Second Opinions, where doctors tell you what they actually think. Today's episode is going to be a good one, so I hope you enjoy it. All right, so like I said, this patient has all of these vague symptoms, right? Fatigue, chronic pain, maybe they even have irritable bowel syndrome that they aren't getting any answers to. This patient falls in just such a prototypical pattern that I see it over and over and over again, and we have to talk about it because the saddest part about these patients is they don't have any answers, and a lot of times they don't feel like they have any hope. So this patient will end up coming into their primary care doctor and they get stuck in what I call the referral loop. So the referral loop is basically you come in, you complain about the symptom. Maybe you get some labs, maybe you get some basic imaging. They don't show anything. And let's say it's a painful condition, chronic pain all over the body. They may send you to a pain specialist. The pain specialist will then evaluate and maybe get some more imaging like MRIs, maybe try a couple different medications, try some physical therapy, still not any better. And all of a sudden they come back in, they say, we really don't have any identifiable pathology to treat on your MRI. So maybe it's a rheumatologic condition. So they send you over to rheumatology. Rheumatology tries to do some medication. Maybe they draw some labs. They say, doesn't seem like there's anything on our screening. Maybe we need to send you to psychiatry. And you start to see what happens there. These patients get passed around from specialist to specialist over and over again. And the one phrase that they hear is that everything looks fine. And this is a complete disconnect between what they're actually feeling and what they're being told. And the result is that they don't trust the doctors that they're seeing, so they may end up getting more referrals. And one of the most frustrating things that happens to them is that not only do they not get answers, but they try all these different sorts of treatments. They spend all this time and money going to doctors, but they just don't get answers. And that's because there is a complete disconnect in how we treat these patients. Medicine was never meant to treat subjective conditions. It just functions best whenever we're treating very objectively findable and treatable conditions. And the problem with these conditions is they're vague and they're very subjective. And a lot of times this is pitted as something that's a disease problem when really it's kind of a lifestyle problem. And right now, our healthcare system is so designed to treat disease and really not designed to treat lifestyle well. And as it turns out, the lifestyle changes are actually very effective at treating these patients. So before we get any more into this type of patient that I see, I want to talk about how the system for healthcare is designed. Overall, we're really good with disease finding tools. And the idea is that if you have a tool like, say, an X-ray or a lab or an MRI, and it can identify something, and that something is abnormal or potentially problematic, then we can treat it. And then you can actually get numeric results from labs or actually physical evidence of treatment on imaging. Then what you do is you do a study, you see how it works, and at the end of the day, you can get a result to see if patients do better, if you eliminate, different lab abnormalities, or if you get like structural differences on imaging. And so a couple of examples of this would be for heart disease, right? If you're able to measure the caliber of somebody's coronary arteries, you can see how much of a blockage there is within that artery. If you can see the blockage, you can then quantify how many patients have a heart attack if they have blockage. And if you open that blockage up, you can then quantify how many patients have heart attacks there. So the result is you could show that by opening up the arteries, you prevent future heart attacks, and you can do that to treat actual heart attacks. And the same thing happens with hip surgery, for example. Whenever somebody has really bad hip arthritis, you can see it on an X-ray. you do a physical hip replacement in them. You can see that on an x-ray. And then if their pain improves and their function improves, there you go. There's your evidence. And that is the type of thing that medicine is really good at treating. Now, the counter to that are the very subjective syndromes that I talked about. Like I said, like this chronic fatigue, brain fog, maybe chronic pain syndromes. These are very subjective. And subjective experience is very hard to quantify because it's not something that we're good at studying just yet. So, whenever these patients come in and they get normal labs, they get normal imaging studies that were meant to identify other problems and are really good at identifying other problems, well, they get told, good news, your labs look good, your imaging looks good. And what the doctor tells them is good news, and what their family member that may be with them at the appointment hears, oh, that's good news. The patient can feel like this is them being abandoned. They're feeling like they're not being heard. They feel like something is being missed. And so these conditions that are the brain fogs, chronic fatigues, even some forms of IBS and fibromyalgia that fall in this category of very subjective with no good modality to kind of quantify what's going on, and one that we haven't figured out just yet, those conditions are really tough to treat. And so we don't have good treatments for them. Okay, before we get into the pattern that I see over and over again in these patients, I want to show you this from open evidence that talks specifically about pain, because pain is such a big part of the patients that suffer from these sort of feelings. So let's start off with nociceptive pain here. So nociceptive pain is very, very common. This is what you think of whenever you have a hurt joint. So the example it gives here is like a knee, for example. You have swelling that occurs, you have inflammation. This is like very common joint related, that type of pain. We think about this with all sorts of pain receptors throughout the body, but it's very easy to see how this works with immune cells coming in, causing inflammation, increasing our sensitivity to pain, and that is how we get nociceptive pain. The second type of pain I want to talk about is neuropathic pain. So neuropathic pain can happen whenever you get nerves that are damaged themselves. And so the example they give here is a spine where you have a disc herniation and it's hitting a nerve. This causes symptoms like sciatica, where you get pain shooting down the leg. Of course, we call this radiculopathy, which just means these radicular nerves are getting damaged. And you can see this in the neck with pain shooting down the arm. But other forms of neuropathic pain exist too. And so a good example of that would be pain related to diabetes for peripheral neuropathy, right? And so you have nerves down in your feet. They aren't getting enough blood flow because the blood vessels are damaged. And so the nerves become painful at that point too. But what we're talking about today is not those two types of pain. It's this nociplastic pain, right? So this is an alteration in how pain is processed in the brain. And this is why we aren't very good at understanding why this happens. But from what we can tell, it's that these structures in our brain, you see the thalamus, the limbic system, the cortex, these are all structures in our brain that deal with pain. They upregulate their sensitivity to stimuli. And so now all of a sudden, something that should only be a minor ache or pain feels severely painful. And it can actually even take things that aren't painful and turn them up and make them into painful stimuli. So that's something that's been newer and has been discussed, and is kind of like this idea of what you see here, central sensitization, is this property that we're really starting to understand how it works within the brain, because this is just kind of the frontier of where neuroscience is. And we don't even have a good way to measure this just yet, but we have figured out that, these symptoms like we can see down here, which are the common conditions I talked about, are now understood as nociplastic. So we have fibromyalgia, irritable bowel syndrome, chronic fatigue, nonspecific low back pain, temporomandibular disorders, so like jaw pain, chronic pelvic pain, migraine, and even like sensitivities to different chemicals and triggers and stuff like that. And interesting enough, we talked about the triggers and predisposing factors. Well, you have physical trauma, you have infections, you have chronic psychological stress, or workplace and family conflicts. So all things that can affect how we perceive the world. And now that we've discussed that, let's let's get into the pattern of the patient that I see. So I explained in the intro how this patient gets passed around the referral loop, right? Oftentimes when I see these patients, and I'm telling you, it's every day I see these patients, you see that they've seen 5, 6, 7 doctors. I've seen some patients that have had hundreds of imaging tests and they still don't have any answers. Patients have tried oftentimes 10, 15, 20 different medications and have done, years of therapy without any relief. And a lot of times when I talk to these patients, I'm trying to figure out what's going on. I'll ask them more about their personal life. And the questions that just don't seem to get asked or don't seem to get any answers at all are the lifestyle questions. I've incorporated a patient questionnaire that we use that checks for these things. And we specifically give this to patients that have these conditions. And what we see over and over again are that these patients really struggle with 4 things. And those 4 things are sleep, exercise, nutrition, and stress. And almost every single one of these patients struggles in all 4 of these aspects. And the question that you have to ask here is that, is this part of the problem or is this the actual treatment? And what you see when you look at the evidence is that these lifestyle changes are not a part of the problem. They're actually the answer and the treatment. And they're really the only significant treatment that we have right now. So let's go further into those 4 things. First off, we have sleep. Okay. Sleep is your body's way of refreshing your brain and healing your body. Now, there is this system called the glymphatic system, and its job is to basically take the neurons in your brain while you're sleeping and clean out all the excessive metabolites that have been produced throughout the day. So this is like a refresher for the entire brain. I almost think about it like janitors coming into a building at night and kind of cleaning all the floors, getting rid of all the trash. So you start the next day with a clean like building to do work in. And that's how I think about the glymphatic system for your brain. If you aren't getting enough sleep, what's happening is you're not letting that system work properly. When that system doesn't work properly, we've all experienced this, right? Little sleep, don't feel good, you feel foggy, just kind of feel tired, and you kind of feel like garbage, right? Okay, so that's sleep, and that's why it's important. That's why it's indicated here, and that's why we see it. And obviously, if you can fix the sleep, then you can likely improve some of the symptoms. The second thing is nutrition. Now, everybody knows that your nutrition is important, and we've all heard of anti-inflammatory diets and stuff. But the truth is, if you have excessive inflammation in your body caused by poor nutrition, whether it be you're eating too much, you're not eating the right foods, you're not timing your nutrition correctly, this is all going to play a part in how you feel the next day. Okay. And you just do this over and over again every day, and you can see how these things start to accumulate. Okay. So we have sleep, we have nutrition, and the next thing, of course, is exercise. Exercise is the most unwritten prescription out there. It should be used for nearly all conditions. And these conditions, especially, it's just the number one most efficacious treatment. When you compare it for depression, anxiety, even compared to them, it works better than the medications that we have available. So I don't want to harp on it, but oftentimes these patients, when I see them, if they're in a lot of pain and their pain tolerance has gone down, what happens is basically they just aren't able to exercise without feeling significant pain. And then it turns into they aren't able to do pretty much anything without significant pain. So at some point, you're going to have to push through that and start building up the tolerance for exercise in your body. And then the final component is stress. I don't have to say a lot about this. If you're stressed out, obviously you're not going to feel good. Now, a lot of people think that stress is a reactionary sort of thing to the other stuff that's going on into your body, but the research shows that you can actually manage stress. And if you can attack stress and make it a treatment point, that it can help all of these conditions. Okay, so the 4 things, like I said, sleep with that glymphatic system for cleaning up the brain, getting you feeling refreshed, getting our nutrition right so we're not having this chronic inflammatory state, exercise, which is good for everything, but that will help your body build up this resistance to not feeling so much pain with doing very little activity. And then finally, dealing with stress and getting stress under control and seeing how that's going to help you feel better overall and decrease the overall sensitivity in your brain to stressful stimuli. So, what's the verdict here? Well, basically, what I'm trying to say is that we don't have everything in medicine figured out. What we do have that we can measure and we can make changes to, like I said, with arthritis in the hips and knees, with heart disease, we've made great progress. But consciousness and our subjective experience with the world is something that we have not found a good way to study. It's something that we can't measure, and therefore we haven't developed good treatments for it. And it only makes sense that if our brain is changing the way we perceive pain, that if we can adjust the way our body perceives pain by making lifestyle changes, that we may be actually able to have a meaningful impact on this. So I don't think that the doctors are wrong here, and I don't think the patients are wrong. I think that it's a disconnect between how we view these problems and how the medical system addresses these problems in general. And I think the doctors out there, as doctors, we want to help people. We want to make them better. And as patients, you don't come to the doctor because you don't want to get better. Obviously, you want to get better. I just think that the system that we have built so far doesn't have good answers for these things. So, what I would advise if you are one of these patients, if you're a physician that's seen one of these patients, or if you know somebody that suffers from these conditions, I want you to prioritize sleep. I want you to eat like it's medicine. I want you to exercise like it's a prescription, right? And I want you to do your best to reduce your stress because all of these together will be the things that actually make a difference for these conditions. Otherwise, what happens is you get put from doctor to doctor. You try treatment and treatment. You don't get answers. You're frustrated, your doctor's frustrated, and everybody around you is frustrated. And I don't want that to happen anymore. So at the end of the day, we just don't have the full understanding of how this works yet. But the treatments that we understand that can make a difference are what I just talked about. I'm Dr. Nolan Fisher. This is Second Opinions. I hope you enjoyed this episode. If you did, please subscribe and share with a friend. We'll see you next week.